My name is Dr. John McGarry. I'm at Plano Orthopedics and Sports Medicine. I'm one of the sports medicine doctors here. Really do mostly sports, but I also enjoy total knee replacements. Been at Plano Orthopedics for many years now, since 2014. I have two children. I have a 13-year-old son and a 10-year-old daughter, and a fiance. So a lot of my extra time is spent with the family. I did my medical school at UT Houston. I did my residency in orthopedic surgery at UT Southwestern here in Dallas. And then I chose to do an extra year fellowship training in sports medicine, and that was here at Plano Orthopedics with Dr. Barber. I stayed in Plano for a few years in practice, but then ended up coming for what I call come back home to Plano Orthopedics, where I'm now a partner. Becoming a doctor, I think my biggest influence growing up was my father. He was a PhD, he was a professor in biochemistry, so it was always very heavy science around the table. I had a heavy background in biology, biochemistry, and a lot of discussions growing up pertained to those issues. Then I had surgery right before entering medical school. I played mostly tennis, but also a lot of weightlifting, and the injury that I had was a meniscus tear on one of my knees, so I just had a quick knee arthroscopy about 6 months before entering medical school, and had a great outcome from there. And I've always been fascinated with the musculoskeletal system, so it was a natural progression for me to enter orthopedics. I love the hands-on. Basically, I consider myself a kind of a mechanic for the body, so I'm using my hands all the time. I'm able to piece things back together, and so it's quite rewarding to have the balance of seeing patients in the clinic and also doing surgeries, treating some patients conservatively without surgery, but also some that need surgery. One of the things that I always find a little disturbing is patients who've seen other doctors and they come and they say, I was told I need to have this surgery. Well, in my opinion, no one needs to have any kind of orthopedic surgery because they're usually elective surgeries. So the question is, do you want the surgery? So I don't ever tell my patients they need surgery. We talk about the options. We talk about the pros and cons of surgery versus non-surgery. And there are plenty of people who just are afraid of surgery, don't want it, so we'll go down the non-operative pathways. We keep that good patient-doctor relationship that way. They come in, they're very comfortable with me. They can tell me what's bothering them. They can also discuss any other issues they may have, because one of my partners may be able to take care of other issues. We take great care of our patients. I want them to feel comfortable talking to us about all of their issues and have confidence that anyone here at Plano Orthopedics is the best at what they do.